Good morning. It's May 27th. I'm Scott Wright and I serve as the city manager of Decatur. So as many of you have seen and heard, the numbers for Decatur and Macon County have sort of leveled off. There are still additional cases being reported, and both of the local hospitals will have from day to day people who are patients under observation or who have positive tests. But the numbers are relatively small, even though we still have cases increasing. And Crossing Healthcare reports that the number of people asking for testing at their facility, which is where we have directed and continue to direct people who, just from the general population, want to go and get tested, that their request for tests has been going down. So I think all of these things indicate that our numbers are level. They're not significantly decreasing, but they are level. And we continue to be part of a central Illinois area where the numbers are either at or below the numbers even for Decatur and Macon County. So what that means is that we can cautiously move forward with implementation of phase 3. Cautiously because we should make sure that there are safety protocols still in place to make sure that at businesses and any other gatherings we're taking the necessary precautions to prevent the spread of the virus, practice social distancing, use masks when we're out in public, and so forth. I want to update you about a city council meeting that was held last night where the city council tried to look sort of on a multi-month basis up until, say, the end of the summer about how we gradually but still very safely move back to whatever this new normal is supposed to look like. They took a couple of actions. The first is they repealed in part or provided a timeline for the repeal of Mayor Moore-Wolf's emergency orders because we are establishing routines, and so the need to make emergency orders that are immediate is less the case. Let me be clear that the repeal of the mayor's emergency orders does not mean that the emergency is over. We still have a problem with this pandemic, and we still need to be vigilant in order to make sure that those numbers don't go up. But we can start to ease back in slowly, and the repeal of the emergency order is a part of that. The other thing the city council did is codify giving liquor license holders extensions to pay their fees and make their applications until the end of August. And there was an extensive discussion at the council meeting last night about how we can help businesses, not just bars and restaurants, but other retailers as well, to get back into business as quickly as possible and as thoroughly as possible, but still comply with the phase 3 rules. So here are some of the things that the city council decided. They decided that where it's practical, that not only bars and restaurants, but other retailers as well, if they would like to do outside sales, whether sales of retail goods or the sale of food and beverages, that could, with a permit, take place on city sidewalks, on city parking areas or alleys or other city properties. You still have to get a permit. The city council decided that in order to make this as easy as possible, that we would waive any permits for this through the end of August. As you perhaps know, there are several merchants that have every year when the weather is warm have had service outside, and there's a permit process for that. And because of that, you can go to the City of Decatur's website and access that application. What's different about this one is that we're going to, of course, waive the fees. We also will make some requirements about following social distancing and other measures that have been promulgated by the Illinois Department of Public Health. Their rules are also available on the DCEO website, and so I would encourage you to find those out if you're wanting to look at some of those, because the city's requirement is going to primarily be just that you follow these virus prevention protocols, that tables are appropriately spaced, that they're cleaned up after every use, that your wait staff uses masks, and so forth. These are the principal requirements of the permit. No fees. Will require you to tell us how it's going to be laid out and so forth. So it will require some kind of a plan. In every way possible, the City Council wants to make it easier, even with these restrictions, for business to get back up and going. All we require on sidewalks is that there at least be a way for pedestrians to get through. The City Council also had an extensive discussion about what sort of enforcement mechanism we should use. They decided not to empower the police department to write tickets for violations of the governor's order. What they said instead is that so far, Decatur citizens have, for the most part, tried to follow these rules in order to keep that curve flat or even going down. And that we've seen a lot of businesses also enforce their own measures, which they are free to do. Measures such as requiring masks or limiting the number of people that can be in a store or a restaurant at any one time, requiring spacing in lines, and dispersing large groups that might assemble. And these are all rules that a particular business is at liberty to establish and to enforce. And that we aren't going to be writing tickets for those, although merchants can decline service if they wish. The other way that the city will try to encourage that we follow these safety protocols is with these permitting requirements. So once again, you can get a copy of that permit now. We're still working, because this was just last night that the City Council made these decisions. We're trying to get information out to the public and to merchants as quickly as we possibly can, and some of that will take place even later today. But for those businesses that are interested in serving outside and having sales outside, you could start by accessing that permit for outdoor sales, which is available on our website. I will also make available some of the services of the Public Works Department. If we determine that seating, say, of customers needs to be protected from nearby traffic, the city has some barricades that they sometimes use for the Decatur celebration that might be able to be used for that as well. This morning I learned that the Decatur Park District is willing to consider some requests for use of tables if the merchant doesn't already have access to his own tables and chairs. This is a fluid situation. The state, for their part, continues to make different rules, and we expect additional rules on safety protocols for liquor license holders to be sent out by the State Liquor Commission as well. So each day there's new rules, and we will use this video and all of the media access available to us to get those out to you. Thanks for your help as we transition to phase 3.
I'm Megan, and I'm a health educator at the Macon County Health Department. And today I'm going to be talking about how to protect yourself from COVID-19 if you're pregnant, breastfeeding, or thinking about breastfeeding, how to protect your infant and or child or children, and what to do about well visits and routine vaccines. The first topic is the risk of COVID-19 during pregnancy. Based on what we know about COVID-19, we believe pregnant people appear to have the same risk of COVID-19 as adults who are not pregnant. However, much remains unknown. As time goes on, new information is gathered and the guidance evolves with it. We do know that pregnant people have had a higher risk of severe illness when infected with viruses that are similar to COVID-19, as well as other viral respiratory infections such as influenza. We also know that pregnant people have changes in their body that may increase the risk of some infections. Therefore, if you are pregnant, it is always important for you to try to protect yourself from other illnesses whenever possible. Risks to the pregnancy and to the baby. As I just mentioned, much is still unknown about the risk of COVID-19 to the pregnancy, but also to the baby. Mother-to-child transmission of COVID-19 during pregnancy is unlikely. However, after birth, a newborn can be infected after being in close contact with an infected person, including the baby's mother or other caregivers. A small number of babies have tested positive for the virus shortly after birth, according to limited published reports. However, it is unknown if these babies got the virus before, during, or after birth. A small number of other problems, such as preterm birth, have been reported in babies born to mothers who tested positive for COVID-19 late in their pregnancy. However, we do not know if these problems were related to the virus. Next is prenatal and postpartum care during the COVID-19 pandemic. It is important to take care of yourself and your baby during pregnancy and after delivery. Do not skip your prenatal care appointments or postpartum appointments. If you are concerned about attending your appointment due to COVID-19, talk to your healthcare provider. Ask your healthcare provider how they are taking steps to separate healthy patients from those who may be sick. Some healthcare providers might choose to cancel or postpone some visits. Others may switch certain appointments to telemedicine visits, which are appointments over the phone or video. These decisions will be based on the circumstances in your community as well as your individual care plan. Call your healthcare provider if you have an urgent medical question. In case of emergency, call 911 or go to your local emergency department. If you are not driving, call the emergency department on the way to explain that you are pregnant and have an emergency. They should have an infection prevention plan to protect you from getting COVID-19 if you need emergency care. Do not delay getting emergency care because of COVID-19. Although there is no vaccine available to protect against the virus that causes COVID-19, routine vaccines are an important part of protecting your health. Receiving some vaccines during pregnancy, such as the influenza and Tdap vaccine, can help protect you and your baby. If you are pregnant, you should continue to receive your recommended vaccines. Talk with your healthcare provider about visits for vaccines during pregnancy. Delivering your baby is always safest under the supervision of trained healthcare professionals. If you have questions about the best place to deliver your baby, discuss them with your healthcare provider. And breastfeeding if you have COVID-19. Breast milk provides protection against many illnesses and the best source of nutrition for most infants. You, along with your family and healthcare providers, should decide whether and how to start or continue breastfeeding. We do not know for sure if mothers with COVID-19 can spread the virus to babies in their breast milk, but the limited data available suggests this is not likely. If you have COVID-19 and choose to breastfeed, wear a cloth face covering while breastfeeding and wash your hands before each feeding. If you have COVID-19 and choose to express breast milk, use a dedicated breast pump. Wear a cloth face covering during expression and wash your hands before touching any pump or bottle parts and before expressing breast milk. Follow the recommendations for proper pump cleaning after each use, cleaning all parts that come in contact with breast milk. If possible, expressed breast milk should be fed to the infant by a healthy caregiver who does not have COVID-19, is not at high risk for severe illness from COVID-19, and is living in the same home. COVID-19 and children. There is much more to be learned about how this disease affects children. While some children and infants have been sick with COVID-19, most illnesses have been among adults. Children with COVID-19 generally have mild cold-like symptoms such as fever, runny nose and cough. Vomiting and diarrhea have also been reported in some children. Children with certain underlying medical conditions such as chronic lung disease or moderate to severe asthma, serious heart conditions, or weak immune systems might be at higher risk for severe illness from COVID-19. Call your child's healthcare provider if you're worried about your child's health or if your child has symptoms of COVID-19. In case of an emergency, call 911 or go to your local emergency department. Emergency departments have infection prevention plans to protect you and your child from getting COVID-19 if your child needs emergency care. Do not delay getting emergency care for your child because of COVID-19. Face shields for newborns and infants. Plastic face shields for newborns and infants are not recommended. There are no data supporting the use of infant face shields for protection against COVID-19 or other respiratory illnesses. An infant face shield could increase the risk of sudden infant death syndrome, or SIDS, or accidental suffocation and strangulation. Infants, including newborns, move frequently, which could increase the possibility of their nose and mouth becoming blocked by the plastic face shield or foam components. The baby's movement could also cause the face shield to become displaced, resulting in strangulation from the strap. Information for how to protect newborns from becoming sick with COVID-19 while in the hospital can be found on the CDC's website. Cloth face coverings for children, parents, and other caregivers. CDC recommends that everyone 2 years and older wear a cloth face covering that covers their nose and mouth when they are out in the community. Because of the danger of suffocation, do not put cloth face coverings on babies or children younger than 2 years. Cloth face coverings should also not be worn by anyone who has trouble breathing, is unconscious, can't move, or is otherwise unable to remove the face covering without assistance. Parents and other caregivers should keep in mind that wearing a cloth face covering is not a substitute for social distancing, frequent hand washing, or other everyday preventative actions. Please wear your cloth face covering in addition to practicing other prevention steps. The cloth face covering is not intended to protect you, the wearer, but it may prevent you from spreading the virus to others. This would be especially important if you are infected but do not have symptoms of COVID-19. Please remember that medical face masks and N95 respirators are reserved for healthcare personnel and other first responders. Finally, well visits and routine vaccines visits for children during the COVID-19 pandemic. Routine well child visits and vaccine visits are still important during the COVID-19 pandemic. Newborn visits. Ideally, newborn visits should be done in person so that your pediatric healthcare provider can check your baby's growth and feeding, check your baby for jaundice, make sure your baby's newborn screening tests were done, and get any repeat or follow-up testing if necessary. At the newborn visit, your pediatric healthcare provider will also check how you and your baby are doing overall. Newborn screening tests include a blood spot, hearing test, and tests for critical congenital heart defects. And well child visits. Your pediatric healthcare provider will check your child's development at well child visits, and you can track your child's development milestones with CDC's free Milestone Tracker app. Vaccine visits. Vaccines are an important part of keeping your child healthy, especially if your child is under 2 years old. Vaccines help provide immunity before being exposed to potentially life-threatening diseases. Although there is not yet a vaccine to help protect against COVID-19, vaccines for illnesses such as measles, influenza, whooping cough, and other infectious diseases are important for your child's health. This will help to prevent outbreaks of vaccine-preventable diseases among young children during the COVID-19 pandemic. Ask your healthcare provider how they are taking steps to separate healthy patients from those who may be sick. Some healthcare providers may choose to delay visits like well child checks and routine vaccine visits. These decisions will be based on circumstances in your community and your child's individual care plan. Call your provider's office to ask about any upcoming appointments or about when your child's vaccines are due. Thank you for doing your part and stay safe.